In this video, we are going to be doing more infection control questions. This is part 5, hand washing, chain of infection, stages of infection, signs of infection. We will have 5 questions. I will read the question to you. I will give you a second to try to critically think through the scenario and come up with your own answer. Then I will read the options and we will discuss. If you need more information on these topics, you can usually find that in your nursing resources under infection control, foundations, fundamentals, and even a bit in OR nursing. So let's get started. Question number 1. The nurse is practicing hand washing after hands become visibly dirty from cleaning a patient. Which of the following are correct hand washing procedures for this nurse? Select all that apply. Is the answer number 1, to keep hands upright and wash to the elbows? Number 2, keep hands and forearms lower than the elbows and wash to the wrist. Number 3, wash with soap and water for at least 20 seconds. And or number 4, apply hand sanitizer and rub together until dry. And the correct answers here are number 2 and 3. And the thought should have been that clean hand washing, we wash to the wrist and we have to make sure to keep our hands down. And we had to pay attention in the question. It said visibly dirty. And if the hands are visibly dirty, or if you're coming out of somebody's room with contact precautions, you should always wash with soap and water. Therefore, if we true-false this, number 1 was false. Number 2 was true, keeping the hands and forearms lower than the elbows, washing to the wrists. Number 3 was true, because they're visibly dirty, we need to use soap and water, and CDC says to wash for at least 20 seconds. And then number 4 was false. So in the further learning, just review proper hand washing technique. For visibly dirty hands, use soap and water, warm water. Keep the hands below the elbows. Wash for at least 20 seconds per CDC. And do not rub the hands dry, pat them dry. If the hands are not visibly dirty or you haven't come out of a contact precautions room, you can just use hand sanitizer and you're supposed to rub the hands until dry. And just a little FYI, if number 1 snagged you a little bit, when we wash the hands upright to the elbows, that is for scrubbing in for the scrub nurse in the OR. 2. When assessing a client's risk of developing an infection in relation to the chain of infection, what would be appropriate actions to include? Select all that apply. Answer number 1. Checking the age, vaccinations, overall health, and chronic diseases. Number 2, ensuring proper precautions and PPE use. Number 3, checking for open cuts. And or number 4, asking about sexual practices. And the answers here are all the above, 1, 2, 3, and 4. And the thought was to remind yourself of the different chains in infection, and there's 5. So the first chain, susceptible host, that's basically figuring out if your patient is at risk for infection, and that linked with number 1, age over 65, whether they have their vaccinations, how is their health, do they have chronic disease? Chronic disease is a form of stress on the body, and stress, whether it's physical or emotional or going to nursing school, can release cortisol, and cortisol is a natural steroid and it can suppress the immune system. So if you've been sick during nursing school, it might be because of your stress level. Number 2 is said ensuring proper precautions in PPE use. That is modes of transmission. So if they're washing their hands, if we're washing our hands, if we're keeping, things clean, then that can decrease the mode of transmission. Number 3 and 4 link to the point of entry. Assess ways that their body can get infected with pathogen. Do they have open cuts? Do we need to cover those? What is their sexual practices? Do they use condoms? How is their, do they have any nasal or, oral issues that could put them at risk for infection? Women with short urethras, especially older women, can get more infections in that area. And then the one in the answers and the thoughts that we didn't talk is the reservoir. Reservoir is basically saying, is your patient good soil to grow pathogens? Do they have a disease that creates a lot of mucus? Bacteria loves to grow in mucus. Do they have pathogens in their blood, or do they carry pathogens in their organs? So that's the reservoir step. So if you need to, you can review the chain of infection, the 5 steps, and look exactly about like what in that step increases risk for infection there. Question number 3. The nurse is explaining to a new nurse how isolation precautions and PPE break the infection cycle. Which statement by the nurse is correct? Is it number 1, wearing PPE stops ports of exit? Number 2, isolation precautions reduce mode of transmission? Number 3, hand washing reduces the patient's reservoir? Number 4, isolation precautions decrease the patient's reservoir? And the answer here is number 2. The question refers to specifically precautions and PPE, and that one stops the mode of transmission. And therefore, in the further learning, it's a great idea to review ways to break the chain of infection. Susceptible host is broken by decreasing that patient's infection risk. The reservoir is broken by reducing growth, so like antibiotics maybe dry up secretion so the mucus isn't there for bacteria to grow in. Point of exit, that part is broke by covering areas where pathogens can escape, so use tissues when you sneeze, cover your cough, cover cuts, use condoms. Mode of transmission, like how the pathogen gets from one person to another, can be broken by washing hands, using precautions, personal protective equipment. And then point of entry, the way that the pathogen can get into another patient is to by avoid exposure, to hand wash, to cover those points of entry. Again, make sure any cuts are covered, make sure condoms are used during sex, things like that. Number 4, the nurse is caring for a patient admitted with viral pneumonia. The patient states he does not understand how he caught it because he was around his sick friend 3 days before and did not get sick the next day. How should the nurse respond? Number 1, you must have gotten sick from someone else you were around more recently. Number 2, sometimes it takes a few days to get symptomatic. That is called the incubation period. Number 3, your friend might not have been contagious at the time. Number 4, there is time between getting infected and feeling sick. That is called the prodromal stage. And the answer here is number 2. And in the thought, you need to remember that there is a time between getting exposed and then getting sick, and that is called the incubation period. So if you kind of get caught on with number 3, your friend might have not been contagious, it says in the question that he was around his sick friend. So if somebody's sick and they're symptomatic, then they would be contagious. So if we look at the further learning here, just make sure you review the stage of infection. There's 4 stages. The incubation stage, which is from the time of exposure to the time of starting symptoms, that's usually 3 days, because remember, the pathogen has to come inside the body and it has to grow. It has to grow enough that the immune system reacts and starts causing symptoms and starts reacting. The prodromal period is right in those first few days when you're starting to feel sick, but maybe not sick enough to stay home yet, but you're contagious. So the prodromal stage is the most contagious stage right there. And then you have the stage of illness, which usually lasts about 2 weeks. And that is when you're symptomatic as well, still. And then the convalescence is after the illness. It's like, you're not really symptomatic anymore, but you're kind of tired and your immune system is recovering from fighting off the pathogen, that bacteria or virus that was inside of you. Question number 5. The nurse is caring for a client post-abdominal surgery. Which signs and symptoms would confirm the client's incision is infected? Select all that apply. Is the answer number 1, incision red and painful with purulent discharge? Number 2, white blood cell count of 8,000 per microliter. Number 3, temperature of 99.5 degrees Fahrenheit. Number 4, your erythrocyte sedimentation rate, which is the ESR sed rate, greater than 30 millimeters an hour, and a C-reactive protein greater than 10 milligrams per liter. And the answers here are number 1 and 4. The thought is to remind yourself of local and systemic signs of infection. So if we look at the further learning, local signs and symptoms of infection, which would be like kind of right where the wound is or the incision, redness, inflammation, pus, which is purulent drainage, pain. Systemic signs of infection, meaning the whole immune system has really become active and it's affecting the whole body. Fever, which is considered greater than 100.4, not 104, 100.4. So if you can look at the slide real quick, make sure you know that. Chills, increased ESR and C-reactive proteins, so that's why number 4 was correct. Those go up when there's inflammation and or infection in the body. The white blood cell count had to have been above 10,000 to be considered infection, and that's why number 2 is wrong. It's not 8,000, it's 10,000. If you also remember the white blood cell count with differential, sometimes they want to look at the different types of white blood cells that are reacting. And in that case, if the neutrophils are up, that means it's bacterial infection. If the lymphocytes are up, that means it's a viral infection. I would definitely know those 2 types of white blood cells. We talk about those a decent amount. There's another lab called procalcitonin that is up in inflammation and infection, especially in like sepsis. And so that can indicate bacterial infection. Hope you enjoyed this video on infection control, hand washing, the chain of infection, and the stage of infection. If you liked learning through questions and critically thinking, subscribe to this channel for more videos like this. Please don't forget to like this video and find us at sciencestrategies.com.